Not getting anything for the special report. Okay. Pressing play.
Passionate, outspoken, insightful. Ariva Martin is an award-winning civil rights attorney, best-selling author, legal commentator, and America's advocate. Live from Los Angeles, this is the Special Report.
Good morning and welcome to our viewers in the U.S. and around the world. To kick off this morning's broadcast, do me a favor. Please share the show with your online friends or start a viewing party. And remember to post a comment or a question. Your voice matters and I want to hear from you. Later in the show, we're going to be talking with two physicians who've been on the front lines fighting COVID-19. So if you have a question for the doctors, go ahead and post it because I am taking questions later in the show. The numbers are in, and they show a staggering racial divide in coronavirus deaths across the U.S. The racial divide at the center of this pandemic, the numbers just continues to grow, and African Americans continue to be impacted disproportionately from COVID-19, 3 times the rate of white people. The numbers show, again, African Americans hit with COVID-19 3 times the rate of white people. And here's some other statistics that I think you're going to find startling. African Americans have died at a rate of 50.3 per 100,000 people. And that's compared to 20.7 for whites and 22.9 for Latinos and 22.7 for Asian Americans. And at the individual state level, the numbers are even more shocking. From Kansas, Washington, D.C., Michigan, Missouri, New York, Illinois, Florida, Texas, and even California, the disparities are mind-boggling. But despite the glaring gulf, the Trump administration's response has been anemic. The coronavirus task force acknowledged the disparities months ago, but there has been little to no guidance on how to mitigate or deal with the shocking number of Black people dying from COVID-19 in this country every single day. So today on the special report, we are asking the question, why are Black people dying at alarming rates? And what are health and government officials doing to address this incredible devastation? Let's discuss. My first guests have suffered an unthinkable loss due to the pandemic. She lost her son, Byron, and daughter, Michaela, within 11 days. Joining me today is Monique Hicks and her son, Deontay. Good morning, Ms. Hicks. How are you?
Good morning. How are you?
Good morning, Deontay. Good to see both of you. First, I just want to express my sincerest condolences to both of you on the loss of, for you, Ms. Hicks, your daughter and your son, and for you, Deontay, your brother and your sister. Just tell us what it's been like, after such a tragic loss.
For me, I wake up every day, still believe it's still a dream. That's how to tell me just to wake up, like it's a dream. Like it hits me every day. Every day I think about them every day. It's hard for me to believe they're gone. My little brother, my little sister is gone. It's very hard for me to believe that. I come by every day to see them, and now when I come to my mom's house, it's hard to believe like I'm not gonna see Michaela or Byron. It's very hard.
Wow. And how about for you, Ms. Hicks? How has it been since the loss of your daughter and your son?
It don't seem real. I mean, I never thought it would happen to me. Just to lose my kids. I never thought it would happen to me. I mean, this virus, I don't know. This virus is something serious. I mean, it's serious. Something has to be done. I mean,
what is it?
Right.
What is it doing to our people?
Yeah, I can't even imagine your pain, Ms. Hicks. I have kids around the age of Byron and Michaela. So as a mom, my heart just goes out to you, your courage and being able to talk about it. And I know you've been using this opportunity, I won't call it opportunity, but you've been talking about your son and daughter's death to help others realize how serious this virus is, and to give a face to these startling statistics. I read the statistics at the top of the show, and sometimes we can hear numbers, and we hear those numbers and we detach those numbers from real people. But I wanted to sit down and talk with you because I wanted people to see that, these aren't just numbers. These are real people, who had lives and who had people that love them and people who are left to mourn their loss. So just tell us a little, Ms. Hicks, about Byron and Michaela. I know you guys live in Florida. You told me before the show outside of Miami, but your son and daughter went to Orlando right before they got sick. Do you know if that's where they contracted the virus?
I honestly can't say, but I mean, that's the only place for the outing and a gathering that we were.
And also, like the sandstorm that came all the way from Africa, like it can actually mess up their respiratory system. Also, the storm, it was around the same time.
Wow. So I think what's so startling about your story is brother and sister, one 20-year-old, your son was just 20 years old. How did he know that he had symptoms? Did he tell you? Can you tell us about that day when he actually went into the hospital?
Actually, he didn't. The only thing he got a chance to talk was once we reached the hospital. I mean, he woke up June 27th. He was having trouble breathing, and Michaela heard it. And Michaela got up and, came in to where he was sleeping. And she was, kept asking him, was he okay? Was he okay? So she walked up to him and asked him to speak, cough, or say something. And he couldn't. So she ran in the room and she's like, Mommy, Byron, something wrong with Byron. Byron is not breathing right. So I jumped up and I came out and I'm like, Byron, are you okay? And he would, he would open his eyes and just like move. And I'm like, Byron, say something. But you can tell in the midst of him trying to say something, his mouth was like full of saliva, like he was choked up. And I immediately called 911. And they came and they rushed him to Florida Medical, where he went in, and the charge nurse immediately said that they had to do a ventilator because he was losing oxygen like very quick. And I'm assuming in the midst of doing the ventilator, he went into cardiac arrest.
Oh, wow.
Yeah.
Wow. So Michaela knew on that day that her brother had passed away, right?
Yeah, she was there. She was there.
And at the time that she was there, was she exhibiting any symptoms when
At
you
that-
all were tending to Byron?
At that time, no.
So
At that-
when did her symptoms develop?
Actually, say 2-3 days after. She was complaining about headache and fever. And we were all sitting in the living room, about the gathering for Byron, talking about Byron and discussing Byron. And she would, sit here and she's like, she's hot. And it wasn't hot in here because, they kept the AC on. So it wasn't hot, but she was like, she's hot. She's feverish. And I'm like, Kelly, just go lay down because I really didn't want to go to no hospital. I did not want to take her to the hospital. And she don't like hospitals. So I had, I kept asking her over and over before I actually got up and took her to Broward General. And eventually she was like, Mom, go crank up the car and go get the car on and turn on the AC, and then I'm coming. And she really did come. So I know she had to really, you know, something was really wrong. So we got her to Broward General, and once they took her for triage, she never came out. She just went, they ended up admitting her.
Wow.
And as
Did she end up on a ventilator too?
yeah, she was at Broward General a few days before the ventilator. I talked to her, say like that Wednesday night, and she was fine. My last conversation with her was Wednesday night. Thursday morning, they called me and told me they had to put her on a ventilator. And from that, they put her on a ventilator. It was something. Her blood pressure low. She lost a kidney. How she lost a kidney, that stuns me. She had liver dysfunction. She wasn't a drinker. She wasn't a smoker. Like, everything just went acting up. It's like, to me, the medicine that they gave her for the infection wasn't for her.
And so she rapidly declined after she went on that ventilator, huh?
Yeah.
And how? So it was 11 days after Byron's passing that you got the notification from the hospital that Michaela had passed?
Yeah, constantly from the time she was in there on June 30th up until July 7th, it was always something. She's doing good. She's stable. She's fine. Then all of a sudden, I mean, she's not doing good. I mean, it was too much. And then my thing is, I couldn't be there to go in her ear and tell her you are a fighter.
Right. So they wouldn't let you in the hospital because of COVID?
Yeah, they won't let you in the hospital. And it's hard. I have friends now that suffer from that. And it's like their family members can't even go in there to tell them to fight, knowing that they'll fight. It's serious out here. It's serious. It really is.
Did you know, Ms. Hicks, at the time, you know, you and I were talking before the show, Florida was one of those states that in May was bragging about how low their numbers were. We saw those pictures of people crowded into beaches, into Florida. Did you have any idea that Florida, you know, had the kind of spread that you know was going, that we now know Florida, as I said, has become like the leader in cases, even surpassing New York. Some of the numbers showed this morning. Did you know that the case count of COVID-19 was rising in Florida?
I didn't know, and I mean, I can probably say back then, not that I didn't take it serious, but I mean, I didn't know it was as serious as it is. So.
And did you have any idea about how COVID was impacting the Black community in particular, that our community was being hit harder, disproportionately harder than other communities? Did you have that information?
Right now, yes.
But not at the time when your daughter and son passed
away.
Away.
I never would have thought.
Wow.
I never would have thought.
Wow. I want to bring Lawrence Alexander into this conversation. Lawrence was actually on the show a couple of months ago. I was talking to him at a rehab facility because he was recovering from COVID-19, and Lawrence had just lost his mother in April to COVID. Good morning, Lawrence. How are you?
Good morning. Can everybody hear me?
We can.
Yeah.
Thank you for joining. I saw you were in the green room, so I know you got a chance to listen to Ms. Hicks
Yes.
talk about her daughter and her son, and Deontay about his brother and his sister. And I know, Lawrence, you lost your mom. You know, how has it been for you and your family, you know, after the last couple of months?
first and foremost, I want to give my condolences to your first guest, because that is such a heart-wrenching story. My mother was 81 years old when she passed away. She left a legacy that we found out later how impactful it was. There was random former students of hers that called us or contacted us and said, your mother was the calm in my stormy life when I had her for 8th grade or 7th grade or something like that. And how many teachers and administrators called and said or contacted us and said that she was one of the best administrators that we ever had. So although, our family's dealing with the loss of our mother, I mean, this family's two young children didn't have a chance to build that legacy. And that's the heart-wrenching part of it. At least my mom, when you have a loss like my mother, there's so much you can take away because she lived a long and wonderful life. So my heart goes out to this family right here.
Yeah, you raised such a good point, Lawrence. It's just really unthinkable when you think about a 20-year-old and a 23-year-old just starting out in life, not having that opportunity to build their career, build their family. So it's just this virus, ravishing Black communities. And I tell you, Ms. Hicks, you are not alone. That's no consolation to you. But since I've been doing this show since March, and I have sat down with so many families, and it's just been so painful listening to what has happened and hearing, as you just said, that you didn't have that information. You know it now, but the information gap. And Lawrence, I know your mom was such a heart-wrenching story, because she went on a Black ski trip where there were so many people coming out of that trip who were infected with coronavirus and who passed away, again, because they were on this trip without information,
Correct.
not knowing that virus was ripping through communities all over this country. What have you learned, Lawrence? I mean, having been a survivor, let me ask you, I mean, I'm so caught up in Miss Hicks and her loss of her kids. How are you doing, Lawrence? Lawrence, you were on a ventilator like Miss Hicks's daughter. How are you feeling?
I am doing really well right now. The main struggle I have right now is building back my strength. Just because when you've been on the ventilator and the ICU for as long as I was, about 5 weeks, I lost like 50 pounds, but most of that was muscle mass. So just building back my strength is like the long-term challenge for me. Going back to like my family's situation, both at one time, my sister, my mother, and I were in the hospital, and my mother passed away. Luckily for me, or luckily for us as a family, my sister's case was bad, but it wasn't bad where she had to go on a ventilator, and she recovered in about a week and a half. So she was out of the hospital. For me, once the doctors understood that my mother passed away, they did everything they possibly could and went aggressive with me. One of the most astounding facts that I always get stuck on is that my kidney doctor, because when COVID is a blood disease, so it goes through your body, and it attacks all your organs, right? If it picks you as the person we're going to attack, then it attacks your organs. So my kidneys are shut down. The doctor put me on dialysis for 9 days straight and pulled out 7 gallons of fluid out of my body. And so every day that, my wife tells me every day that I had dialysis in the beginning, I became a little bit clearer every single day. So just cleaning my blood the way they did we believed was the thing to save my life. But this is during the beginning. So these are all things that people weren't trying. They didn't know if it was going to work or not. They were just experimenting, basically.
Yeah. Did you know at the time Lawrence, again, the data has been slow in terms of how it's been coming in and how it's been reported, and it's been so poorly handled at the national level. But did you have any sense about the disproportionate impact of COVID on Black, communities, Black families, and African Americans as a whole?
Not necessarily while I was going through it, but as a student of African American studies, I have actually a bachelor's degree in African American studies. It's not surprising to me because we are, a bottom caste in America. Yes, we have a few individuals who are highly successful, but as a group, we're on the bottom. So, like the famous comment, when America catches a cold, Black people catch the flu. This is no different. You look at all the essential workers that have to go out and risk their lives because they're important workers, but they're not getting paid as important workers. Their healthcare isn't as robust as some other people with better healthcare plans. So how many people are getting turned away because they're old or their healthcare is not the greatest, or there's some sort of implicit bias into the thinking. Like case in point for me, I am a big heavy guy. However, the COVID-19 was my first serious illness. Overall, I've been a reasonably healthy guy.
And you raise a good point about that, because we've heard a lot about pre-existing conditions, and there's this debate going on among some people that somehow African Americans' lifestyle choices are the reasons that we're seeing these alarming rates. And you did say that you were a heavy guy, a big guy, Lawrence, but that you hadn't had a serious health condition like COVID. And I want to ask you, Ms. Hicks, your daughter and son, you guys were on a trip to Orlando. So presumably they were functioning, they were walking, they were, doing what it is that young people do. Had your daughter or son been hospitalized ever before?
No, ma'am. No, ma'am. Well, I apologize. I'm sorry. Michaela was about a year ago. She was hospitalized due to pulmonary issues.
Okay.
She was put on a ventilator, but she fought it.
Right.
She fought it.
Okay.
I mean, that was, like I said, that was over a year ago. I mean, before this COVID, no, this is like for Byron especially. This is his first.
Wow. And he died so quickly from it.
Exactly. It didn't give him a chance.
Yeah. I just want to ask, all of you, what pains you the most? What has been the most difficult part of this entire experience? I'll start with you, Lawrence. What's been the most difficult part for you?
From a family standpoint, I think there was a particular assumption of my mother being 81 years old that she was, of ill health, but really she wasn't. She was a strong woman at 81 and was probably going to live until her mid 90s. The only thing she really had going on was diabetic, but she took pills for it and she was never on insulin or anything like that. So she didn't have any really major health issues. And she was a very strong woman. Like I said, she went on a ski trip to Idaho. But I think from what my family reported back to me was that it seemed like there was this kind of assumptions made about where she was in her stage of life, and they may not have fought as hard for her as they possibly could have. Plus,
so it's kind of like she's 81, she's lived a long life, people in their 80s die anyhow. Was that kind of the attitude?
Yes, that kind of attitude.
Wow.
Now, I can't say that for sure. That's a speculation on our behalf, but it just seemed like they were fighting for her. Like basically my hospital team fought for me,
but she didn't have that. They didn't feel like that same fight was made to save her life. How
Exactly.
about for you, Deontay? What's been the hardest part for you?
Pretty much that I couldn't see my sister and brother. We couldn't grow old with each other. We also like they left behind their nephew that they love so dearly. Like he comes to me, he tells me he miss Byron and Kayla, and it really hurts him. If I coming into my mom's house, I have to make. I ask them every day, "Are y'all okay? Y'all good? I love y'all." Because it is very different now. It's real different. It's not the same anymore. Like me personally, I just don't know like how is my life really gonna be. Like it's already affected, but it's like my life is really my sister and brother is really out of my life now. It's crazy. It affects my mother a lot. It affects my sister, my siblings. It's just different. I never would have thought to lose both of my siblings or either one of them due to this COVID.
How about you, Ms. Hicks? And yeah, Deontay, I can't even just say I'm sorry enough to you because it's just so painful. And Ms. Hicks, what's been the hardest part for you as a mom, losing your two kids so close together?
I miss my baby. It's not the same without them because they were so outgoing, but friendly. They were, and it's hard. It's hard. It's hard. I miss my baby.
Wow.
Ooh. It's hard.
Yeah.
Hard.
I don't even know, Ms. Hicks, how you have the courage as a parent. We owe you so much as a community because in the midst of that pain and anybody that's a parent, and Lawrence, I know you're a parent, we can feel your pain. We can't know what it's like to be in your shoes, but the fact that you're willing to talk so openly about your kids are going, your testimony is going to help so many other families and people who aren't taking this virus seriously, people who don't believe that it can happen to young people. Your son and daughter, dispel that myth that this is somehow just for older people.
You can have anyone. Just take it serious. It can be anyone.
Yeah.
Just take it serious. Take care of yourself. I mean, it's out there. It's serious.
Yeah.
Take it serious.
And thank you for those words of wisdom. I'm going to just end with you, Lawrence. I'm glad that your doctors fought so hard for you. But one thing we know about COVID-19 is that it is disproportionately impacting African-American communities, and that bias that you talked about is real.
Yes.
It's real, from Black people not being able to get testing to not being listened to even medical teams not, fighting for them in terms of the care that they receive. So we wanted you back because you are a success story in the sense that even though you lost your mom, that you pulled through. And we're so grateful and just so excited that you did pull through and that you're able to, again, carry forth that message of how serious this is and how we need to address these biases that exist in our medical system. So what is it that you want people to know, Lawrence?
Truthfully, what I want people to know is that Black people have been dealing with a 400-year pandemic called systemic racism. And until we deal with the issues with that, we're always going to have these types of sad outcomes. If you go back to Hurricane Katrina, where you have people waiting for their last paycheck to escape this monster hurricane coming through, and they got wiped out. I mean, it's one thing over another thing over another thing because our wealth position was stolen from us. And until we get made economically whole, until we have medical and legal equality in this country, we're going to continue to see that. And how many people, regardless of race, are sick and tired of that and willing to stand up for that and really push for economic repair?
Well, we got to leave it at that, but thank you so much, Lawrence. You're right. This isn't new for Black folks. We've been dealing with systemic racism for, centuries. And right now, in this moment, a bright light is being shown on those inequities. And hopefully we'll move past this conversation about the problem and we'll start to see some of those solutions implemented. Again, Ms. Hicks, to you, just, the most heartfelt condolences to you and your family. We will keep you in our prayers. Deontay, you hold your mother up. I can tell, I haven't met you before today, but I can tell you're a great son. And, in times of crisis, we turn to people we trust, people we love. So you continue to be there for your mom and for your family. We're counting on you to help her get through this. So again, our heart goes out to all of you, and thank you for joining us, and thank you, the three of you, for sharing your stories with us this morning.
Thank you.
So heart-wrenching stories, on the special report, we don't shy away from those difficult stories. And this morning, this is painful. This is difficult because these are babies. These could be my babies because they're the same age, and these could be your babies. So that's how we have to think about this. And Lawrence talked about systemic racism and fighting systemic racism. And our next guest has been doing just that. She's a state representative from the state of Texas that has also been hit hard by the coronavirus. She is State Representative Sean Thierry. Thank you so much, Sean, for joining me this morning. I saw your story and wanted to reach out to you because Lawrence put this so eloquently, correctly, by talking about the systemic issues. And COVID-19 is just one of many systemic issues that the African-American community face. And I know you represent a predominantly Black community in Houston. So tell us what your solution is to address some of these systemic problems.
Absolutely. Good morning. I want to say first to the Hicks family, I'm so very, very sorry for your loss. I've been listening to the entire first segment, and what we've seen, unfortunately, is this trend is going the wrong direction. It's not only the Hicks family, it's many, many, many African families, and what we're seeing is the mortality rate is much higher for COVID-19 in our community. So I want to send my prayers and condolences, but I want people to know that there is work to be done. A few months ago, I noticed there was an alarming trend occurring in Texas, where I live, and particularly in Houston, that the infection contagion rate of COVID-19 was much higher than the population rate in the African-American community. So I started to wonder and say, wait a minute, now what's going on? Because as you correctly pointed out, we've seen this in other health conditions. We've seen it in maternal health care. We know the maternal mortality rate is high for Black women. So I wrote a letter to Governor Abbott back in April, and I provided data to him that we had on hand at that time that said, that we are going in the wrong direction, that something needs to be done. So I requested that the governor form a COVID-19 task force, a racial disparities task force, to address these trends that we were seeing in the African-American community. And I was fortunate enough to get some bipartisan support for that because there's political implications on all sides. And so we got support from Democrats and Republicans. I want everyone to know there is some positive news. The update is we haven't formed the task force, but the Department of State Health and Human Services is creating a study to look at this issue. But we have a need for speed. We need to get going. As we can see, African Americans are dying at an alarming rate. I want to say that Lawrence is exactly right. Implicit bias plays a part in this, and that is part of what I wanted to be addressed by the task force. You mentioned choice. You know, I heard this morning, I want to send prayers and condolences to the families. I'm not even sure if everyone who's listening is aware, but the youngest person to lose her life now with no pre-existing condition for COVID is Kimora, and she's from Florida, Kimora Lyman from Gainesville, Florida, 9 years old, no pre-existing conditions, went to the hospital with a high fever and is now deceased. So these are the kinds of things we want to look at. Why did the hospital release her so quickly? You know, this is these are the health inequities that we're seeing and the stories that we're hearing, real-time stories on the ground. I know personally 4 to 5 people now who have passed away from COVID-19. That's far too many for one Black woman to know. And so
I just want to ask you, Sean, what will this task force do? So, you know,
yeah. So
what's the
specifically,
goal?
we're going to start first with the data. So we asked for five specific charges for the task force. Number one was collection and reporting data regarding the number of COVID-19 cases identified by race and ethnicity per county, per city. You might think that we have that data right now, but you mentioned something earlier, and we call them data gaps. There are still highly unreported cases right now. There's not a protocol right now where all of the testing facilities and hospitals are actually reporting the race and ethnicity of those that come in that are infected, but obviously the mortalities we can get from the death certificates. Number two, we want to, and this is really important, identify safety bundles, guidelines, and treatment plans and protocols for those that are deemed high risk. So if we already know that African Americans suffer from asthma at a high rate and have underlying respiratory conditions, why are we prescribing the exact same treatment protocol for African Americans? And in fact, I want people to know it's not even the same treatment protocol. Many Black people who are going to the hospital saying they don't feel well, they get diagnosed with COVID and they're told to go home and self-quarantine. On the opposite side, we're hearing white Americans are being told, set up a telemedicine appointment with your primary care physician and we'll monitor your symptoms day by day, and perhaps you may get on some sort of a steroid treatment before you develop full-blown pneumonia, which would prevent you from having to get on a ventilator. So we want safety bundles and protocols. Number three, we want to address the role, and you guys have hit it on the head all morning, the social determinants of health that increase COVID-19. So whether it's a health insurance issue, are there other issues, Medicare? Texas right now is number one in the country, unfortunately, for the number of uninsured residents. We want to address the role, Lawrence, you mentioned this, and of implicit bias. There's been study after study in many, many health conditions that Black Americans are not treated with the same level of care, even when it comes to pain assessment, that we are waiting in ERs at longer time periods. They are slower to prescribe us pain medication, that residents at medical schools actually felt that Black people have thicker skin and therefore could be poked harder with a needle. So when I say thicker skin, I mean physically thicker skin, not the antidote. So we want to find out if implicit bias is playing a role. You mentioned things like choice. There are those that may feel, well, if you're overweight and you have diabetes and you have an underlying condition, maybe it's just par for the course that you're just going to have to live with COVID, or you may have to die with it. That's not acceptable. And then the fifth charge that I asked for was to build an effective public awareness campaign, an education campaign targeted to underserved communities with specific emphasis on reducing community spread. So right now in Houston, we're doing a better job. We have a mask up campaign where we're really making sure that everyone wears a mask, wearing your mask properly. I've seen, I'm about to do another video later this week that says it's not a chin strap, pull it over your nose, make sure you have yourself fully covered, washing our hands constantly. So we want awareness campaigns. I'd like to see that being partnered in our communities with historically Black colleges and universities, as well as faith-based leaders, so that we can truly have a community collaborative, and there needs to be funding for that. So I'll pause on that.
Well, I just want to thank you for the work that you're doing, Sean, and hopefully this task force model can be a model that's adopted, outside of Texas, can be followed in other states and hopefully at the federal level. So we're going to track you and continue to follow you and follow what happens with that task force. Again, thank you for your work and your leadership on this issue. So important that leaders at the state level step up, because we're not seeing it happen at the federal level. So again, thank you for your leadership on this issue.
Thank you, and thank you, Cass, and thanks for highlighting this issue and spreading the word. We really appreciate it. We've got to get the message out, so you play a big part in that. So thank you.
All right, thank you. We've been talking a lot about this concept of implicit bias. We've been talking about Black community and why they've been hit so hard. So can't have this conversation without talking to our medical experts. So we're going to turn now to them. These are two women who've been on the front lines of fighting COVID-19. One is Dr. Patrice Harris. She's the former president of the American Medical Association. And the other is Dr. Sheila Young, who's joining me this morning. Dr. Young actually is a site director of a testing center in the heart of South Los Angeles. Dr. Young and Dr. Harris, thank you so much for joining us this morning. I know both of you have been in the green rooms. You've heard these horrendous stories. The Hicks story, we just heard the state representative in Florida tell us about this 9-year-old little girl, no pre-existing conditions, doesn't fit any category, but yet she died of COVID-19. So, and both of you have been on the show with me before, and rather than things getting better from 6 weeks ago, 8 weeks ago, it seems like things are getting worse, particularly in states like Florida and Texas, and even here in California where I am. So I'll start with you, Dr. Harris. What is going on, and why are we continuing to see this rise in cases in the Black community in particular?
Well, thank you. And it's good to be back on with you. And I really appreciate you highlighting this issue, because there's so much misinformation and disinformation out there. And unfortunately, we still have people who say that COVID is not real. And so it's very important to get out accurate information. We are absolutely going in the wrong direction in this country on many levels. And of course, from the very beginning, we saw a disproportionate impact on Black and Brown communities. And so as we go in the wrong direction, we are seeing an even greater disproportionate impact on Black and Brown communities. And I will imagine, I will predict, and I don't do that often, that when we analyze the data at the end, after we get through the acute phase, that will be even greater than we thought. Earlier, you mentioned the fact, or your earlier guest mentioned that we were not collecting data, and particularly not collecting data in any meaningful way that we could compare. And so that's why at the beginning, the AMA asked the CDC and the HHS to collect that data. And so I think the gap will be greater, but we do have some data, and we are seeing it and actually living it every day. And I also have to agree that we cannot spend another second blaming people. Truly, there are pre-existing conditions, and if you have diabetes and if you have hypertension, but the reasons for that are complicated. Certainly, we can talk about choices, but I always say the choices you make are based on the choices that you have. But at any rate, we should not spend another second blaming people, but really committing to what we can do in the short term and what we can do in the long term. I'll just say one thing about testing, because my colleague here is in the thick of things. But, in the beginning, we knew that we did not have the test, and everyone called on the administration to make sure we did more testing. But it's not just the actual testing, it's the whole apparatus behind the testing. And we needed that data to focus that testing in hard-hit areas, Black and Brown communities. And we still don't have that. I think we're still relying in a lot of places, Black people to come to the testing rather than the testing going to the community. And I still think, we need to address all of these issues around unconscious bias. We need to make sure that when there is a need to quarantine and isolate, we need support for that. A lot of times Black and Brown families live in high density areas, and they don't have the privilege of living in a 5-bedroom home where they can quarantine and isolate. So we need support for that. So I think for these reasons and many more, we are continuing to see this disparity, and we really need to act. No more talking. We really need to make the commitment to act.
And I just want to, before I ask you, Dr. Young, to weigh in on this, when we were researching for this show, my producers found some really startling national headlines, stories in the national news about African Americans who have died because they were denied a test. So like there was a story about 6 Black patients who died because they didn't get a test. And then there was a story of a healthcare worker herself whose daughter said she was denied a test on 4 occasions. So this testing conundrum that this country is in, 1, not doing enough tests, 2, the test results not coming back quickly enough. But now we're hearing about African Americans in particular being denied testing. So what's going on with this? What are we to make of people just out and out not being able to get the test, even though we know the testing isn't perfect? But if you can't get a test, that has to be the beginning of a very bad situation for you.
Yes. Go ahead.
Because you're the testing guru.
Well, let me just say this, just to address a couple of the issues that you brought up previously, which were data. So fortunately for us in Los Angeles County, our Board of Supervisors passed a motion at the beginning of this crisis to include race and ethnicity data on everyone who registers for a test. And I literally called the PIO, the person who's in charge of that, and we let them know what information we needed on the information that we would need in order to ensure that we had equity with testing, because testing was in short supply, it was expensive, and we initially noticed that the places with the most cases were also the places that were the most wealthy in Los Angeles County, which were Beverly Hills, Brentwood, Santa Monica, West Hollywood, downtown LA as well, and Manhattan Beach. Those are also places where a lot of physicians live in Los Angeles. So we have that information. And one of the startling things that we found was that our percentage of Black people testing positive for COVID-19 was actually low. It's actually less than 5%. Yet in Los Angeles County, we were seeing the highest rates of death. So what explains that disparity? Again, I think that Mr. Lawrence hit it on the head, that it is bias. We've had interviews with a group called Black Women Rally for Action, where people have been denied access to medical care. One woman.
To understand what you're saying, Dr. Young, you're saying the numbers were skewed because Black people weren't able to access the testing?
No. What I'm saying is that of those we tested, the rates of COVID-19 were actually low. So one of the things, and I believe that this is also misinformation, is that there's this idea that the rates of COVID-19 are actually high in the Black community when it really isn't. Oh. So the data that we have doesn't demonstrate that.
But is that data extrapolated across the country? Because that seems to contradict all the data that we've been getting back from places like St. Louis, New Orleans, Detroit, where they're saying,
well, if they're not actually looking at the actual number of cases, what they might be looking at is the death rates. And even with our information, you see it in our state public health reports. It demonstrates a difference in the number who are positive versus the number who die. Yet news outlets continue to state that there's a high prevalence of COVID-19 among the Black community, and that is not true. So what we're looking at—
That's like really big news that you're making, Dr. Young, because that is so inconsistent with every news report that we've read in researching for this show. And I just want to ask you, Dr. Harris, you spent a lot of time over the last couple of months. I've seen you pretty much on every television station there is talking about this. Is that consistent with the data that you've seen?
It is not, but I wonder, and I'll let Dr. Young say, I think if we don't have the number of tests, if I was assured that testing had been equitable and everyone who required a test by medical criteria, and of course that's different around this country, and we had that data. I think one of the things, and Dr. Young may agree or disagree, is the data is incomplete. I mean, I would like to see, so the areas, this by zip code, I would like to see the number of, and I would like to see a complete picture, the number of tests given, the percent positive. I would even like to see the kinds of tests because, everyone is lumping antibody tests and antigen tests and a lot of tests. So I would like to see all of that data, and then by race and ethnicity, gender, even zip code. So I think one thing right now is the data is incomplete. And so in one zip code, we have folks with a lot of tests and perhaps percent positive. In another zip code, we have percent test, and we have to look at percent illness. So I think one of the reasons we're seeing a lot of different interpretations is the data is incomplete and it's not consistent, and it is difficult to draw complete conclusions. But I want to learn more about what Dr. Young said, because that is also not what I had been hearing and seeing in my review of the data.
So
So
that's
we
pretty
actually,
shocking information, Dr. Young, because that would say that all of the reports that we've been getting for the last couple of months, including information coming out of the CDC itself, you're saying that information is inaccurate?
based on our experience, and if you look at our county, and if you look at our state data, because we push this for race and ethnicity to be listed in our testing entities, we've tested over 20,000 Black people in South Los Angeles. And based on our information, they have a low rate of COVID-19. So less than 5% of people were positive for COVID-19. And this is South Los Angeles. We're situated in the Compton, Willowbrook area, Watts area. We've had to change the way that we do testing to ensure that people have access, which includes on-site registration. We've had to educate people that we actually have an oral swab, not a nasal swab, available at our testing site. We've had to let people know that they didn't necessarily need to have insurance to get tested either. And so we've overcome a lot of barriers. And again, we have a report. It's on our website. It's the CDU COVID-19 updates website. You can scroll down and you can see the report that we have. But again,
I'm sorry, has this data that you said this 5% of your testing population of African Americans have tested positive, has that been shared outside of LA County? And do you know, how are other health officials in these cities like St. Louis, Baltimore, Detroit, New Orleans, who, are saying, even Sean Thierry, who was just on from Texas, who talked about the numbers in the state of Texas and Houston in particular, how are they responding to your testing results or your findings?
I'm not sure if it's been reported, but it's not just for Los Angeles, it's actually for our state. So that data is available on our state website as well, which demonstrates the difference in the positivity rate versus the number of deaths.
So let me ask you this, Dr. Harris, can it be the case that this data that has been compiled by Charles Drew for the state of California, could it be different? Could the numbers in California represent something totally different than numbers in Missouri and Texas and other states? Or are we to extrapolate from those numbers that the positivity rate for African Americans is just wrong?
No, and I think Dr. Young will agree. We should resist extrapolation. We should really be basing our interventions on local public health data. And if that is a local public health data there, then good, then they can do what they need to do. But again, and this is, I think, actually was one of the issues in the very beginning, because I think we saw what was happening in New York. And people made a couple of assumptions. One, that was New York. It won't be us, right? They made that assumption and they didn't do because there was time at the very beginning to prepare rather than folks saying, we're okay, this is just going to be New York or on the coast, so we're good. We're going to open, reopen bars and restaurants. So I think that one thing. And then on the other thing, when New York, and the folks of New York who did the work that they did, right? And California too, because they both, really worked hard in the very beginning and restricted. Then everybody also extrapolated that, oh, New York's better, so we're all out of the clear. So I think the lesson learned is we need the local data. And then based on the local public health data, the local public health officials should advise the government officials as to the next steps. It's all local here.
So I do want to clarify, I'm not saying that we don't have to be concerned.
Oh yeah, I know. And by the way, I knew you weren't. I was just saying how people looked at New York in the very beginning. It all is about local data.
No, and I do want you to clarify that, Dr. Young, because I don't want anyone to leave having watched this show and said, oh, this is a lot of hype about Black people being infected disproportionately from COVID. So whatever programs we're doing, we can stop because, it's fake news anyhow.
No, so what I want people to understand is that Black people are dying at disproportionate rates up to COVID-19. So we have to, again, when we look at blaming and shaming and blaming pre-existing conditions, okay, we have to look at what the truth is. And the truth is, there's multiple factors, but the one factor that we've seen is that people are being denied access to advanced life-saving care. Again, I mentioned there are stories on that we are continuing to do with Black Women Rally for Action. And people have literally had to beg to be admitted to the hospital. One woman, Erica May, in her story is on the Facebook page. She said, I can't breathe. If you don't admit me, I am going to die. And so the other stories that we've heard as well, believing that a person is a certain age and they won't survive, so they won't be offered life-saving care.
Right.
It's been shared with us that even, Black people who are educated in certain positions, in this county, in Los Angeles, that's happened to them. And so what I'm saying is that we know we don't have to stop taking the measures. No, we don't continue with our public health actions and education and outreach. We want to continue with that. We need to continue with that. We need $38 million to run a program that will allow us to test 1,500 people a month in South LA for the next year. It costs money to do the testing, the outreach, the education, and the follow-up. So the message is that there's a huge disparity between the number of people infected versus the number of people who are dying. That's the message.
And I want to ask you, because the message is so important when we talk about public health, and the message has been politicized, and we know that even a recent Pew Research poll shows that Republicans are more likely, Dr. Harris, to think that African Americans are bearing the brunt of COVID-19 because of their lifestyle choices. We heard Secretary Azar say that on a news program a couple of weeks ago, and we keep hearing this message, and it's resonating, unfortunately, with some people that somehow our lifestyle choices are to blame. And Dr. Harris, can you just speak to how do we dispel that myth that this isn't about the choices that we are making? This is about, as you said so eloquently, the choices that we have. And if you know anything about Black people and health, you know that our choices are limited, from the food that we can buy to the air that we breathe, that we've been given some pretty poor choices.
Yes, and so I think the way to dispel that myth is to make sure that everyone has accurate information. And of course, as we talk about bias and discrimination. We have to talk about 401 years of structural and systemic racism, discrimination that have led to us getting to where we are today. So the way to dispel the myths is to say, no, that is not true. That lacks a very nuanced understanding of the complexity. It's about access to healthcare. It's about bias. It's about quality healthcare. You know, many institutions in areas that are communities of Black and Brown folks don't have the resources, right? And so you just may have one MRI. This is bigger than COVID, one MRI machine or one machine, which means folks, can't get an MRI as quickly. I was just talking on a panel the other day. Again, this is a little bit beyond COVID, but I think this is a great example. We know that people live in food deserts, right? And I was on a panel with a physician from Tulsa who just gave the very explicit example that if a patient who lived in a certain zip code around Tulsa wanted access to fresh fruits and vegetables, it was a 4-hour ride on public transportation. I can tell you, I can get to my grocery store here in Atlanta. I have a car in 10 minutes. And then I was just on this morning, a panel on maternal mortality and morbidity, and talked about the fact that Black women aren't listened to, aren't heard. And there are maternal deserts, the same as food deserts, where the local there are no obstetricians or hospitals in that area. So we have to really appreciate and understand this in that broader context. And that's what we'll have to continue to keep saying whenever anyone resorts to a very reductive explanation that it's all people's faults. That's very reductive and does not appreciate the nuance of where we are today.
We're running out of time, but I told my viewers that we're going to take a couple of questions. So I just want to ask these really 2 quick questions. I'll start with you, Dr. Young. Hearing those reports about people, Black people in particular, who've been turned away from testing, if that happens, one viewer had the question, what are they to do? If you show up at a facility, you show up at a hospital, and I had some guests on in the show earlier in the year who that actually happened to. His mom had symptoms, his father had died, his grandfather had died, but they did not want to give his mom a test. What should someone do if they are denied a test?
They have to continue advocating. They have to advocate, and if that particular facility does not offer them a test or does not offer them admittance to the hospital, if they don't offer them advanced life-saving care, then they need to go somewhere that will. And so that's part of being educated about the hospitals around and what their capacity is. And it is up to our communities to do that work on the ground. For example, discussing resources. Before COVID-19, there were only 52 ICU beds surrounding the CDU campus. UCLA has 130. This is before COVID-19. Cedars-Sinai has 130. LA County USC over 130 as well. So when we look at that, and when we look at how people are able to access certain hospital systems or where the EMS takes them, we've got to be on top of that. And that's why we want to create a program of healthcare advocates. And we want to create this nationwide where we'll have a hotline or a social media page that you can go to say, hey, I need help. And we can deploy someone out. The other thing is having knowledge. Have your own pulse ox, okay? If your pulse ox is less than 90, they shouldn't be sending you home without oxygen or without follow-up. So there's a lot that we can do, and it really comes down to us advocating for ourselves. If you don't have health insurance, that doesn't mean that they should turn you away.
Right.
So you've got to push, and you've just got to push, and if they don't want to accept you, you have to go somewhere that will.
Great,
and that's why we need medical schools and programs where we can train physicians who actually want to take care of our people.
Absolutely. And so, Dr. Harris, I'll ask you the last question. A viewer wants to know if we're now being encouraged to, go outside and to do events outside, but we're also seeing that a lot of these personal private events are turning into super spreader events, but people are still flying, and we're not hearing about large, outbreaks on planes, which we know can be very packed and, poor ventilation. So if an event at your house, a birthday party, turns into a super spreader event, why aren't flights turning into super spreader events?
Yeah, that's interesting. And I think we have some ways to go before we learn about that. And listen, I am no expert on air circulation, but I did see a report last week from an engineer who said that the air circulation that they have on planes is superior to perhaps some indoor venues that we have, on the ground. So again, that's a report. I'm no expert in that, but that could explain what you just mentioned, because people are flying, although not as much as we used to. And I would say, yes, we want people to go outside. Certainly we need people to wear masks. It's not partisan, just wear your mask so that we can all work to reduce the spread, hand washing, and keep 6 feet apart. So outdoors is okay, and get some exercise whenever you can. As we get more information, we'll share that about the airplanes. But indoor restaurants and bars are really, unfortunately, I wish, because I love dining out, but they are just a perfect venue for spreading COVID-19.
Well, we've got to leave it there. And I know there are lots of resources that are available at the state and local level. We're going to post some of those resources on our website. I just want to thank you both, Dr. Young and Dr. Harris, for lifting your voice on this important issue and helping educate the community. Knowledge, we know, is power. And unfortunately, even though we've been dealing with this pandemic for 5 months, there's still so much that we don't know. And there's still such a huge information gap, particularly in communities of color. So again, thanks to both of you for your leadership on this issue and for helping keep communities of color safe. Thank you.
Thank you.
Thank you.
Wow, there is so much to talk about, and we could talk for hours with our experts because, again, there's so much information we don't know. But I want to thank my guests today for joining me for this conversation. Again, our deepest sympathy to the families that have lost loved ones and to those families who are still struggling with COVID-19. I just realized that one of my own nephews in St. Louis posted on Facebook. I didn't know he had COVID, and he talked about his journey. He has asthma and how difficult it was for him to recover. So I had to reach out to him myself last night. So it's probably impossible to be in America right now, particularly if you are an African American and not know someone who has been impacted by COVID-19. And sadly, you may know someone who has lost a loved one to this just devastating disease. Again, so thanks to my guests, thanks to all of you for joining me this morning. Continue to follow this conversation. You can follow me at Ariva Martin. We're going to continue to have these, difficult and sometimes very painful conversations because we know that we've got to get the word out, and we change behaviors by talking about the behaviors and providing people with accurate information and facts. That's so important when we're battling a public health crisis like this pandemic. And what we've seen, for me over the last 5 months, I've interviewed so many African Americans who lost someone to this deadly virus. And now 147,000 plus people have lost their lives in the United States alone because of COVID-19. And we are well past the 4 million, going on 5 million people that have been impacted. And you would think, given all that this country has been through, that our federal and state officials would have figured out how to prevent so many Black people from dying at such startling rates. But the exclusion of Black Americans is not new in this country. Racism, bias, ignorance, misconceptions in medicine have been a part of our America for centuries. But one thing that's different right now, we're talking a lot about Black lives, but Black lives can't matter if we don't commit to changing the healthcare system during this pandemic and after the pandemic. And what that means is prioritizing African American testing centers and treatment for COVID-19. It means confronting the systemic issues such as lack of affordable health care, lack of testing, lack of high quality medical facilities in our neighborhoods. And it also means confronting the lack of healthy food options, lack of green spaces and recreational facilities. We must accept that health problems, including higher rates of COVID-19, manifest in the Black community, not because Black folks don't take care of ourselves, but because healthcare resources are criminally inadequate in our neighborhoods. And while we are in the midst of this national conversation about race and equity and inclusion, it's time for America to fully embrace that for African Americans, like all people, we must embrace that our health is our wealth, and health equity is the ultimate way to make Black lives matter. Y'all be safe out there, and don't forget to wear your mask. And remember, we are all in this together.